Okay, taking your blood pressure can be very nerve-wracking to many people because if it's higher or lower than usual, there can be side effects. People may also get nervous to take their blood pressure that because they are afraid that the person taking the blood pressure doesn't know how to take it correctly. So I'm here to talk to you and show you today how to take your blood pressure the correct way, what the top and bottom numbers of the blood pressure mean, and how your blood pressure can benefit to self and society. So let's pump right into how to take your blood pressure. According to practicalclinicalskills.com, first you have to make sure that the cuff fits the person's arm. Then you wrap the cuff around the person's arm right above the artery. And then you have to make sure that the stethoscope bell is right below the artery to make sure that you can hear the heartbeat. And then once you can hear the heartbeat, you pump the cuff up to 180 degrees. Which I'll kind of just do a little bit. And then you release the cuff at a moderate rate. But before you release the cuff, make sure that you can hear the first knocking sound of the heartbeat, and that will tell you the top number of your blood pressure. And then make sure that you keep listening for the last knocking sound, which will give you the bottom number of your blood pressure. And then your blood pressure should be close to around 120/80, which is the normal blood pressure rate for an adult. So now that you know a little bit more about how to take your blood pressure, let's move on to what the top and bottom numbers of your blood pressure mean. According to healthline.com, the top number refers to the amount of pressure in your arteries contracted of your heart muscle. This is called the systolic number. And the bottom number refers to your blood pressure in the heart muscle of the beats, and that's called the diastolic. Both of these numbers play a big role in the state of your heart. Lastly, let's talk about how your blood pressure will get benefit to self and society. It is very important to check your blood pressure on a regular basis to make sure that you are not at risk for an abnormal blood pressure. An abnormal blood pressure can be high or low. According to CDC.gov, 29% of Americans are at risk or already have high or low blood pressure. This is nothing to mess around with. So now let's recap. First, we pumped right into how to take your blood pressure. Then we moved on to what the top and bottom numbers of your blood pressure mean. And then we lastly talked about how your blood pressure can benefit to self and society. Concluding this speech, I hope you have learned something, and next time you take your blood pressure, it is less nerve-wracking for you. Thank you.